how will a vaccination mandate be enforced? And they mentioned like for students, faculty, and staff who come onto campus. I guess how will we verify that they're vaccinated? How will they prove that?
Sure. So I guess I'll pause here and take the next couple of sections of the question separately. But if you've been coming to campus recently, you've had to complete LumiSite, right? And then in LumiSite, it's a questionnaire where you answer questions. For instance, have you had a sore throat or runny nose, or been in contact with someone, or have been told by the Department of Health or any other healthcare or agency that you must quarantine or isolate for whatever reason? If you answer yes to that, immediately LumiSite will tell you to stay home, right? Quite frankly, in past semesters, we've had very few areas that have had the need to validate this information, primarily because we had very few students on campus and very few staff. But for instance, in the library has always required validation of the LumiSite app. And if you do not have a phone or a computer at home to access and complete the LumiSite app, you have an option to completing it on campus. That was at the point of the questionnaire. If you're to go today to the LumiSite app, there's a health tab in the app where you're actually able to indicate the information on the vaccinations, as well as upload a picture of your vaccination card. The alternative would be a negative COVID test, right? And so what's going to happen is that the LumiSite app is going to validate the information and provide a visual on your phone or on a printout or when you produce it on campus that basically indicates that you are either vaccinated or have taken a recent test and been negative. In addition to that, you've completed the questionnaire. That is going to be basically like an entryway into many of our common areas, right? So we're not necessarily going to be policing it at the gate on the campus, because that's a little bit difficult, especially our campus has many access points. But in indoor spaces, that is the way in which we are going to be enforcing the vaccination and or COVID negative test results to gain access to on-campus resources.
Must students be vaccinated in order to come to campus, which you have already answered, because they'll have the option to do the negative test.
Right.
And the third question is, are there any changes to the mandate or upcoming semester plans due to the Delta variant that has emerged recently?
Yes, so I will share that some things have fluctuated, because an earlier iteration during the summer, when we were seeing some really good traction on COVID, we were actually thinking that, you know, masks may not be as necessary depending on the circumstances, but right now we do see the need for the mask. And so as an example, if you ever came to visit me in my office is a suite. So my secretary sits right outside. And so we both have more than 6 feet of social distance between us. When I'm in my office, I don't wear my mask unless there's someone in my office, right? But as I walk out, even out to my secretary's space where she has plenty of space, I'm already wearing my mask again, something that I had sort of relaxed. And so as a campus, we are leading by example. And so we are wearing the masks when in doubt. When it's obvious, we are wearing them. When in doubt, we're wearing them anyways. And even outdoors, you're all aware that city and county don't require the mask outdoors as long as there aren't large congregations. On campus, we are again leading by example. More often than not, we are all wearing our masks when we're outside. And so we're just practicing a lot more safer conditions. And so while I would want to say that things are changing, I think that we took such an abrupt approach at the beginning of the pandemic that we're just going to sustain very similar practices with the addition of the required vaccination or COVID negative results.
Do you know why students do not receive the vaccine?
Repeat that, I'm sorry.
Do you know why students do not receive the vaccine?
You know, I could only share speculation and opinions. And so it's quite dangerous to go down that path. You're all probably aware that I'm a biologist and I have actually ample experience working on virology. And so some of the challenges that exist is that generally speaking, when a vaccine is in development, it takes an extensive period of time for it to be tested and for the science community and the medical community to assess side effects and long-term issues that may come about with the vaccine. And so generally speaking, the FDA is that entity that once they are comfortable with the mass of science behind the vaccine, they're able to approve it. That step has not happened. And so there's hesitation because if there are some side effects or long-term effects or other issues that may have not bubbled up yet, there's hesitation in exposing yourself to something like a vaccine that appears to not have too much testing behind it. That is, in my opinion, a solid reason for having hesitation. There are other reasons that I will not elaborate too much on, but there are, reasons that may be beyond the science behind it, but there could be some cultural or religious beliefs, and there could be some underlying health reasons why, students may be opting out of the vaccine. But we are seeing that there's been a little bit of an uptick recently. And so there's a lot of reasons why, you could be on both sides of the equation. From a scientist perspective, I have to tell you, the amount of resources and time, collective time from the scientific community that has gone into the COVID-19 vaccines far exceeds any of the other vaccines developed. And so, there is some level of comfort there, but until the FDA doesn't approve, we do expect there to be some hesitation.
Topic. Is UH supporting students that do not have access to technology or lack viable equipment? And if so, how?
Sure. And so we're all taking slightly different approaches, but all moving in the same direction. Like we have in the past, computer loanouts are an option. Hotspot loanouts are an option. Having resources made available to students like kits to work on certain labs or maybe activities are also happening. And so we are providing access like we were in past semesters. We did not hit a ceiling in terms of how much technology we were able to lend out. I think that maybe at Y&I, they needed a little bit more and were willing to contribute more in terms of the technology available at Y&I. But additionally, resources on campus will remain open to our students and actually a little bit more open than they were before. As you may be aware, we had some offices provide almost exclusively distance services. As of July 6th, all of our offices are open. They may be a little bit restrictive because we don't want to, again, allow for congregation. But these offices are available, including computer resources on our library, for example, and other spaces where students would be able to take advantage of these. But I think that the greatest limitation the students experience in the past, and this is based on surveys that came out, were not so much access to computers, but we were able to address that, access to reliable internet. Even though we had provided hotspots, the reliability of that internet is also a little bit questionable. But providing outdoor spaces on campus where internet is accessible is something that we will keep having. And we are adding additional furniture and outdoor spaces for students to feel a little bit more comfortable on campus and not necessarily having to share space. I myself have walked around the campus quite often, and I would see students in different spaces taking their classes. And so we will continue to provide those resources as we move forward.
Question. In a newsletter, it stated that unvaccinated students may be excluded from certain activities. Why so? Why wouldn't weekly testing be sufficient while a non-FDA approved drug was in circulation? Once federally approved, fine, but in the interim, no exclusions should occur when testing can be conducted.
And so there exists some possible activities and or resources that may be limited only to vaccinated students. For Leeward's purposes, I'm speaking quite frankly, and we haven't developed all of the restrictions yet. We've not identified any specific areas that would require the vaccinated students. I think that was more related to the four-year institutions that have, housing situations and athletics where there is more of that exposure and contact. And so therefore that was a requirement. Additionally, we're trying to be very careful because as part of my mission, and this is my mission individually, but I share it with the college, we don't want to impose a barrier from our students being able to complete. And so if I don't have an option that allows for an alternative like remote completion of a program, I don't want to necessarily overexert a restriction that pushes our students out without them having options. And so we don't have much of that here at Leeward. I think that testing will, for the most part, take care of those restrictions. I don't want to over-validate that statement. There may be something that I'm not thinking about that may require it, but the hope and the direction that we're taking is that if it is a sole service, meaning that there's something that cannot happen in any other way, I would want there to remain a testing option for students to take advantage of the resources. And so again, I think that the statements on spaces or activities that may be restricted only to vaccinated students was very pointed toward more of the athletics and housing situations.
For you. And will the weekly COVID tests for unvaccinated students be free of charge? If not, how and when will those have to be paid?
Sure. And so for this semester, those will be covered by the university. And so, however, please keep checking your email for updates because it will not be any test. There will be specific vendors as well as specific types of tests that will allow you access. And so as you've probably heard or maybe even taken advantage of, the state travels requirement requires very specific tests and very specific vendors to be validated. And so we're moving in that direction as well. More details will come relatively soon. I have been a strong proponent of these tests being accessible in all communities. So I don't want them to be so restrictive that a student needs to travel 15 miles to get a test to come to campus for the one day of the week, right? And so we want some opportunities. But again, for this semester, for students, the test will be covered by the university.
I have a question following up on that.
Mm-hmm.
How will it be paid? Like, will the student have to pay out of pocket and then submit to Leeward for a reimbursement, or is that something that you would work out prior?
So that's why I don't want to let out too much of the details because we haven't finalized it, but I'll share an idea that actually I kind of suggested, and I'm hoping that that's where we go, where it's on a voucher system, where maybe we provide you with a code or a voucher and you're able to go to a vendor or a site and provide that in lieu of a payment. I don't want the students to burden the payment. I don't want to promise that that's the way it goes because we got to validate that and we have to have a partner willing to do that with us. But an alternative to that would be that we host some of the testing on campus so that, again, that cost is not extended over to the student.
Why is there miscommunications going around? I feel it was wrong for the system to say they will wait for spring 2022 to mandate, yet we now have fall 2021. I find that bullying. Will the students that did not get the vaccine but does not qualify for an exemption get dropped from classes? Also, I thought we just had to wait for it to be FDA approved. This is just wrong if they're mandating it now.
So just to cover that, we are not dropping students if they're not vaccinated. It's just a requirement that there is a weekly test that we're trying to extend as easily as possible to the students. So again, it's not a mandate that you're vaccinated. It just generates an easier access point to the campus resources. But with the weekly test, you wouldn't need to be vaccinated to take advantage of the fall 2021 coursework. Quite frankly, I heard in the news today that the FDA may be contemplating within the month or in a month's time to approve the vaccine. We've heard that before. And so again, it's something that we're hoping happens relatively soon, but if it doesn't, we'll continue to pivot in providing access and resources to our students. So again, the mandate is an easier access point. The testing should provide the rest of the access to students that haven't been vaccinated. There may be some very minor, tiny exceptions where there may be a vaccination requirement, as is the case with athletics, I believe. But for Leeward perspective, we've yet to identify one of those resources or spaces where the vaccination will be required.
So we went through all the questions that we got asked through our Google form. And unless anyone else here has any sort of questions, I think that's all. Or unless you decided you have another update, Carlos, after answering all those questions.
You know what? The only thing that I would want to share with everyone is keep checking your UH email, because updates are coming about quite often. And with recent events as early as recent as late last week with the vaccination requirement for state and county employees, I do want you all to remain informed. And I know that, you know, Lexer and you as student government do keep the campus community and the students informed. But I do want to avoid miscommunications. And so if there's ever an instance where something is too nebulous to understand, please go ahead and, you know, connect with me in whatever way so that I could provide that answer. And I'm happy to have these meetings as often as necessary to, you know, remove as much doubt as may be out there. But please keep checking your email, keep up to date on this information. And as soon as we have the testing information available, we'll blast out that information and provide more resources so that you're all aware of what the requirements are. And so with that, I want to thank you for your time. I appreciate meeting with you and the questions that I get. Understand that because some of these things are changing almost by the day, it's difficult for me to have a solid response always, but I try to provide you with the most up-to-date information whenever asked. And so thanks again. I'm looking forward to engaging with you this academic year and looking forward to seeing you even if on campus with a mask. And so with that, aloha and mahalo for all that you do.
Thank you.